The use of relationships is very important in behavioral theory. It's particularly important in working with children. A lot of parents will come in and their children are having some kind of problem. So, being able to use the parent as, a key player in, providing behavioral therapy to the child is key. There was a study done by Mulm in working with parents who had children with behavioral problems who were not necessarily at like a clinical intervention level, but the child definitely needed, some kind of help to correct some kind of, maladaptive behavior, whether it was, tantrums or refusing to do schoolwork or whatever the case was, and having the parents or whoever was living in the house with the child and whoever was working with the child outside of the home, like a teacher, was just very key in implementing a successful intervention. Walsh also talks about the importance of, the relationship with the therapist, between the client and the therapist, as being necessary in order to implement change. In working with clients using behavioral theories, you're trying to help them change behaviors that are going to make them feel uncomfortable, that are maybe stressing them out. You might be asking them to do things that make them feel panicked and feel fearful. So you want to have a good, warm, trusting relationship with your client, or they're not going to be willing or trustful of you, and they're not going to want to make that change.